Well, thank you, Randy, for being here. I wanted to ask you, as we reflect on the history of the American Society of Echocardiography, of how you just became first acquainted with echocardiography as a technique.
Well, it's interesting, Al, because I have the unique sort of schizophrenic background of after I did my medicine at Stanford in the late 60s and early 70s that I'd started down a path I thought I was going to be on, which was ophthalmology. I was actually doing an ophthalmology residency in Miami at the world-famous Bascom Palmer Eye Institute. And having spent time at Stanford, okay, and actually I remember Dick Kerber coming into the cath lab with an old M-mode echo to look for pericardial effusion in somebody who may have been perforated. I was fascinated with cardiology and with echo. And so after a sort of a difficult decision, I ended up going back to do cardiology at Stanford in the mid-70s. Don Harrison actually took me in because I'd had a lot of experience in cardiac rehab, and bumped into Rich, of course, with M-mode and phonos and apexes, doing all those things that we did at that point in time. And I guess, I was enthralled with it. I thought it was the coolest technique. And then Rich gave me the opportunity to really get in on the ground floor of the development of 2D echo. He had the prototypical Varian machine, which was a massive machine that occupied a wall, and we were in a hot closet, and that was it. And so that day, seeing two-dimensional echo and understanding that echo gave you the capabilities to actually look at people's hearts, that you could make diagnoses, you could understand physiology, and you could change management of patients. So it's really my experiences at Stanford and really through Rich Pop that I got intrigued with this technology.
So the state of the art really was you were going in the transition from M-mode to 2D.
Absolutely.
Doppler hadn't come along
No,
at the
Doppler.
time.
In fact, Doppler did come along. I hate to sound like this, but pulse wave came along, and when you'd search around in the left atrium, I thought that was crazy. I fortunately. Again, and we've talked about this through relationships with companies, and there were no financial relationships. I didn't get anything out of it, but I had deep relationships in a consulting with IREX. And IREX at that point found out about Vingmed's CW Doppler, and I had the first analog CW Doppler in the United States because I'd left Stanford in '78 and gone to the University of Virginia, and we actually talked to Liv Hatley long distance internationally as she tried to teach us how to use that analog CW. And a fellow I had then, Brad Stam, and I looked at 25 aortic stenosis patients with CW Doppler and found that you could calculate gradients. Yeah. So I was fortunate in the ground floor of the development of 2D echo and really the launch of CW Doppler in this country, and then of course color and transesophageal echo
followed
came
that. Yeah, that's very good. How did you become interested in the American Society of Echocardiography? What was your introduction to that?
Probably carrying Harvey Feigenbaum's bags. He thought I was a bellboy, I think, at one of these meetings. I've told the story many times, but there used to be an echo meeting down here that Rich would come to. It was actually in San Diego. When I say down here, an audience doesn't realize where we're sitting, but it was in San Diego. And I think that it was sponsored, or a part of it was American Society of Echo. And Rich introduced me to Harvey as we were coming in, and Harvey was bringing his bags in, and I think he thought I was the bellboy. He asked me. But I think, again, watching the leaders in the field and seeing what they were doing, that I decided to become active with the American Society of Echo, and as I recognized that it was going to be the educational, at that time, the educational and sort of the home of the development of echo.
And you became involved enough to basically have an important role in the first meeting. What are your reflections about that? That's back 1990.
The recollections is that you were president, I think, of the society, and you decided that we should have a national meeting, which everybody thought you were absolutely insane. And I think the first meeting that we had was in Washington, D.C. Yeah. In fact, the first one or two meetings were there. And Jules Garden, wonderful Jules, was appointed to be the director of the meeting, and I was his assistant or co-director. And believe it or not, the only thing that I did right about that meeting was that I said we should have some kind of entertainment, and we stumbled upon the Capitol steps, which were at that point in time were a fabulous comedy routine. But to your incredible credit, not only was the meeting a success, not only did more than 3 people came, I think 500-600 people came, but it was a raging success, and that it was a chance not only to learn, but to have a really camaraderie about people coming together in an environment for a few days to sort of learn and share about ECHO. And, here we are many years later with these meetings being an integral part of our society.
Yeah, I remember there was a lot of trepidation about that meeting, but I think you played a very important role, and actually that entertainment from the Capitol steps went over in a fabulous way. We had 750 people at the meeting. I think it was the biggest ECHO meeting at the time, and we had them back the next year. We had 1,000 people when Ned Wayman was president.
Well, no, I think, and that's Harvey called me at one point the court jester of ECHO, but I think that having, that's really what I was trying to make the point, is that this is really part of the core of ECHO, is that not only are we interested in the science, not only are we interested in the field and what the impact it can make in a research or in a clinical role, but we have really had a fabulous relationship among ourselves, enjoying each other's presence. And so I think, and did then, I do now, is that educational entertainment or just fun entertainment is part of the ambiance of life. And I think clearly, I think that it helped make that first meeting and launched us.
Well, I remember you got into the act as well.
Very
few people will remember that, but you actually participated in helping the Capitol steps entertain us. But you went on then to become president of the American Society of ECHO.
I was fortunate enough to be asked by then the nominating committee to be the president. This was at a time it's interesting because every president, including yourself, maybe except Harvey, I can't remember whether Harvey had 3 terms or 2. Harvey was number 1 and Rich was number 2. Every president had a 2-year term. And I remember at that point maybe I brought it up or somebody had brought it up. I was very busy not only with my career, but at that point I was doing television, and I was really doing a lot of commercial television stuff, and I didn't think I had the capabilities to do 2-year commitment. And so my presidency was the first 1-year presidency, which is an interesting deal. I mean, it's because at that point in time, we didn't really have the rhythm of how you transition, as you know, and many presidents know, is that it takes a little while to understand the workings of the organization and get yourself so you can accomplish something. So it's not 9 months into your presidency say, oh yeah, I got it figured out now, and then you're gone. So I think it was an interesting transition time. I think we did it well, and the society did well. We were talking and trying to remember what things went on, and I clearly remember a lot of things. But I had one of the things that stands out to me is that although we are the American Society of Echocardiography, I had the wonderful opportunity to, because of my leadership role, interact with other society presidents and other societies, individuals. I think of somebody who's gone on to be a dear friend, Dr. Fausto Pinto, who was then president of the European Echo Society, European Association of Echocardiography, my colleagues in Japan, and in other areas. So that part of my push then, and I think importantly now, has been the concept to recognize colleagues in other countries and in other societies who've also played a key role in sort of pushing echo and echo techniques along, and really that we're colleagues, and that we should be ambassadors of this technique.
Now, you've participated in the activities of a number of other cardiac-associated societies like American Heart, American College. How would you characterize the American Society of Echo vis-a-vis those associations?
Well, I mean, I think that the beauty of the American Society of Echo is what we've talked about in a lot of these interviews, is that basically those of us, and we are very, very fortunate that at the time of this interview, that all of the past presidents and a lot of the key members of the society, sonographers, staff members, are all still alive and well. We've really grown up together, and Tony talked about it, not only professionally, but in friendships and family developments, and have really become a family. And I think that, as well as the relationship we've had with sonographers, and in fact the relationship we had with industry early on, with this tremendous collegial sort of relationship, is far unique in medicine, not in cardiology. There is nothing else in medicine that has the vibrancy that the American Society of Echo and the field of echo has. So it's drastically different than anything else. And I think that's part of why the technology has done so well. Not only is the technology good, but you had people that enjoyed each other using the technology.
Yeah, I think there's been a great deal of congeniality among the members that I haven't seen in other societies, and I think it's reflected on not only by you, but by everyone else who sat in the chair.
Yeah, sat in the chair, and we've
in the hot
interviewed.
seat
That's
there.
right, I know.
So what is your thought about the future? Where is Echo going to fit in as we move forward? What are your thoughts?
It's interesting to me because I've been fortunate. Even though I'm older, I went back to do echo, so I can actually think I'm younger. I'm fortunate to get in at sort of with M mode, Doppler, Apex, and then get in on literally on the birth of 2D echo. Nobody knew how to do it. I mean, Joe was doing the Grumman and Harvey, and I think Walt had been using the mechanical things, and I got in on that, and then my echo gave me many wonderful friends, but a dear friend, Harry Rakowski, who came out and spent time with us at Stanford, and we've been close to this day. So I got in on that, and then Doppler and all that stuff. I think that when we look at echo today, I think that if we look at medicine today, tremendous challenges, as there is in our society in general. Technology is the king. Communication technology is king. But the real question is, how is technology going to make an impact in people's lives, and how can how do we sort of marry this tremendous need to serve people who need care, cardiology care, let's say, with the tremendous financial burdens that care has carried, okay, meaning it's not exactly the right word, but serving the underserved, the people. So I think we've got to find a role for echo, which is the ideal cardiac diagnostic technique. I've said many times, you give me a transducer in my hands, and I still image every day. I still do a lot of transesophageal echoes, so even at my old age, you give me a transducer, there are very few things I can't figure out today. And so we've got to be able to translate that into a cost-effective way to approach cardiac diseases diagnostically, and then to move it into areas of pre-disease diagnosis and prevention, I think will be very important. So I think the challenges are going to be, what is the echo machine or machines going to look like in the future? Is it the pocket stethoscope officially? I think clearly there. The high-end machines are spectacular. How do we translate advances into really making a difference in a cost-effective, high-quality outcome? That's going to be the challenges.
Oh, great. I want to thank you not only for this interview, but also for guiding us in the project that we're undertaking to convey the whole history of how this all came about, from a niche technique to a technique which is now part of the fundamental fabric of evaluating a cardiac patient.
Thank you, Al.
Okay.